Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say with myself, Dr. Lauren Brindisi, and I'm here with one of my patients, Kristie. Thank you so much for joining us today, Kristie.
Hey guys.
I'm excited to talk to you about everything that you've had going on and your journey here with CFNC and just your journey as a whole, which I find super interesting. So tell us a little bit about, let's just jump right into it. Tell us a little bit about what were some of your initial diagnoses or symptoms that you were experiencing?
Well, so it started out with just simply a rash. I had this rash that would start in my chest and in my face, almost like as if like someone, if they have a little too much wine or something, like a flushing kind of feeling. And it was very infrequent at first, where we thought maybe food allergies or allergic to something and whatnot. But that started way back 2016, a long time ago. So my symptoms were very sporadic at first. It was just really the random rashes and upper respiratory issues in my lungs and constantly on prednisone and antibiotics and all the things. And that went on for quite some time until I really started to regress in terms of my symptoms, and they became daily. And then I started having chronic reactions, almost like full-blown anaphylactic reactions, like surges of I'm about to pass out, I can't breathe, my heart rate's a million, I need to lay down in the supermarket, kind of scary. And after that continued to progress, no one really could tell me what was wrong with me. Run around in terms of been to a million allergists. It seemed like I was allergic to something, but everyone kept telling me I was not allergic to anything on the planet. So kept getting circled around millions and millions of doctors until then I finally started developing these dysautonomia symptoms, I think from the chronic reactions. So I could eat literally anything and my heart rate would jump through the roof, feel like I'm going to pass out. Couldn't control my heart rate during exercise. So I am an exercise physiologist. I'm a trainer for a living. Just could not handle any cardiovascular type exercise. I was surviving on prednisone all day, every day for a lengthy period of time. And then I ended up getting COVID in November, this past November. For the first time, I was lucky. Kind of avoided it like the plague because I had a feeling if I got it, it was really going to send me into a spiral. And that's exactly what happened. All my neurological symptoms just kind of went totally haywire. Short-term memory issues, severe depression, word recollection issues, brain fog. It was like I was like a skeleton of myself. I just couldn't function all day, every day. But looking at me, I looked fine. Your slogan, right, is not all things can be seen. And that was really me. I lived this lifestyle, a healthy lifestyle, and I was just struggling all day, every day to just function on a daily basis. And it got really bad leading up until I found you guys.
Yeah, thank you so much for sharing that. Before we get into your experience with CFNC, what we want to let people know about is what type of care were you receiving prior, or what type of avenues did you explore before you came to CFNC?
So I'd say this started back in November 2016. I'd say up until 2021. So about 5 years of efforts on my part, research and waiting lists for doctors. I was in the more Western like medicine world, and I was being circled around because my issues were whole system. You know, they were systematic, where I'd go to an allergist and they tell me I have no allergies, and he would send me to the rheumatologist, and she would tell me I have no autoimmune disease and send me to another allergist, and then a cardiovascular specialist, and then a gastroenterologist, because my symptoms were all over the place. They were my whole body, but our Western medicine system kind of just like, you know, focuses on the one part, and they just kept spinning me in circles and telling me I was fine, because my blood work pretty much always came out healthy. I'm a healthy individual, you know? So that was about the first 5 years of frustration. And then I sought out the functional medicine route. I started seeing some practitioners focusing on things like leaky gut, where, you know, a lot of people out there can do a leaky gut protocol, an elimination diet, and some gut healing supplements and things like that. And they'll feel great, you know, pull out the sugar, pull out the dairy, and take some of these great supplements and you feel awesome. But my body was almost too far gone at that point that anything I would take, I was having these mast cell reactions. So like something like glutathione is a great detoxification supplement. I could drink it down and almost instantaneously pass out. Not actually full syncope, but like would have to lay down, like the world is spinning, like my body would just full react to it. So I got to the point that there were so many things that I needed to be doing to heal what we found out eventually was mold toxicity and mast cell activation and dysautonomia. But at that point, it was almost like I was too far gone, that all the things that you would think and know and research is out there to do, I couldn't do any of those things, like take glutathione or do a hot sauna or any of those things that like would be prescribed. So basically most of the physicians I saw in later years were just kind of like, it was a toss up. They didn't know what to do. Nobody knew what to do. I mean, you and I have talked about this. Mast cell activation only became a diagnosis in 2016. And my symptoms started in 2016, you know, so there's not a lot of information about like, how do you help a person with mast cell, especially a person who has mast cell that has it because they have mold, you know? So how do you treat the mold? It's like the chicken and the egg. Where do you start? Do you start at her brain, or do you start at the mold, or do you start with the reactions? Where do you start? So just a lot of different physicians with different opinions, and everyone unfortunately was kind of making me worse. As I continued doing more and more treatment and trying more things, I kept reacting more and getting worse and worse, which was so frustrating.
Definitely. And I'm going to put a pin in some of that for a moment, because when we get to talking about your experience at CFNC, I'll chime in a little bit and kind of talk about how we pull those things together and hopefully help our listeners dealing with similar things get a better understanding of why one approach may be better for one person versus a different approach be better for the next person.
Right.
But before we get there, Kristie, how did you find us?
Actually, on just researching on Google, the last practitioner I saw kind of was at a loss for what's going on with me, and had read some more research and things about how COVID was causing dysautonomia symptoms. So when I did get COVID in November, I had been under her care for about 4 or 5 months at that point. Wasn't really sure why I wasn't getting better. I don't think she necessarily had an answer, but then COVID came, and she assumed that I had POTS syndrome at that point, or some version of POTS. And it was not under the scope of her practice. So I started just searching around and trying to find, and you guys popped up, luckily.
So glad you were able to find us.
Yes.
That's a big reason we're putting all this content out. We want to let people know that we're here, that functional neurology is here, and other alternative ways to get treatment. Mm-hmm. So let's talk a little bit about that. So you ended up coming in, we had a conversation. I said, I think it'd be a good fit. Why don't you come for an exam? And you're a few hours away. You're not right in our backyard. So what was your experience like here at CFNC?
For like the intro, like my first exam, or just coming for the like the treatments, which part, or all of it?
Yeah, let's kind of walk through the timeline. You ended up coming in for an exam, and then we'll go from there.
Okay, so drove to North Carolina. I'm in South Carolina, so drove to see you guys for my first exam, and had all the anxiety in the world, fearing that, you know, this is going to be the probably 60th intro doctor visit that I've had at this point. And I in previous years have almost never been validated that like I am actually sick. You know, I've been told I'm crazy a lot and this is in your head and maybe you should see a therapist and your blood work looks fine. Maybe you should just get used to it, you know, all the things. So a lot of anxiety leading up to the appointment, but walking in there, immediately felt like I was in the right place, which is a great thing. Just felt extremely validated in my feelings, with my heart rate feeling the way it was, my breathing the way it was. It's so funny, like patients out there can probably understand where I'm coming from with this, but like a lot of doctors didn't believe my reactions or episodes. So like right before our appointment, I know coffee always made me not feel very good. So I chugged a coffee right before I came in to see you, and I'm like, they're going to believe me this time. I know it, you know, and that's what happened. You guys saw my blood pressure was a little messed up. My heart rate was like 160 while I'm talking to you. And you looked right at me and you said, you definitely have some dysautonomia. And it was like, oh, thank God. Like someone believes me, you know, which so it makes you feel insane sometimes when people aren't listening to you, you know, and validating your symptoms, especially being a healthy individual who does her best every day to lead a healthy life, you know. So just then from there, I was like super excited to start treatment. I ended up starting, I think, coming there for intensive, like it was about 3 weeks later. If you had told me to come tomorrow, I probably would have been there. I was ready. I was comfortable. I was like, let's do this. And started treatment with you guys. And I like the approach, that there were multifaceted things we were doing. So like the heart rate retraining, the hyperbaric chamber, the red light therapy, there was a lot of different aspects. I will say the hardest part for me as my personality was doing less. So like I was like ready to do more. I'm like, Dr. B, tell me what to do. And you're like, go take a nap. You know, and like, or like, what should I do when I feel this happen? You should lay down and put your feet up, you know? So for me, being a motivated individual, it was a very hard pill for me to swallow, to just press pause on my life. And like, when I have symptoms or like when there's a problem, I'm the type of person that wants to do something about it. So having to do less in order to allow myself to heal was a tough pill to swallow. But it was 1 day at a time, 1 week at a time. And it was just amazing. Like after week 1, you know, doing our tilt table, my heart rate would be through the roof. But like week 2, it was only 100. And then week 3, I was standing up instead of just laying down. And then like week 4, I was running. So it was just kind of amazing, that I just went along with what you said, and doing less was the right thing to do almost. But now we are, you know, I'm home now and continuing, and we're moving on to different phases of the treatment and stuff. And it really feels great.
Love that. I think that you touched on some really great things that I just want to repeat. And I say that to patients all the time. Less is more. You need space for healing, especially when we're talking about any area of dysautonomia. It's not that we want you hiding in a dark room by any means, but your limitations are a little bit different, and we need to maximize the efficiency of your nervous system. So most people are used to just go, go, go. And we have to kind of restructure that mindset as well. And that doesn't mean that it's permanent. It just means for a period of time, we need to kind of reevaluate what doing something means, because sometimes it means just laying down for 5 minutes and giving your body a chance to reset. Now, I want to talk to you a little bit about, because I think this is a big piece for people who are listening who have mast cell activation syndrome.
Right.
When Kristie came in, what we started to understand for her case specifically was that certainly the mast cell was driving everything else. And she had already known that she had mold toxicity before she came in. So we understood some of those mechanisms. Then you throw COVID into the mix. And now the neurological implications of these inflammatory processes had really set in.
Yeah.
So generally what I see with other clinicians is that sometimes people will want to fix and go right for the mast cell issues and the immune mediation issues. And for a lot of people, that is a great route and is the right route, because that was the primary issue for you. However, by the time you got to me, Kristie, you were so sensitive, like you already touched on, to the world around you in general. I mean, you could eat anything and you were having neurological complications just from eating the food. So we needed to come in through a different route. And this is the part I really want people to understand, is that if you do have mast cell and you have some immune complications and you've now developed neurological issues, sometimes we need to backtrack the reverse way. And that's what we did for you. You had exhausted a lot of other options, like you said, the leaky gut protocols and some things that work for a lot of people out there.
Yeah.
But in this world that I live in terms of the patient population that I see, it's a very, very sensitive population. So sometimes we have to go a little bit of a different route, and less is definitely more. I feel like we talked about that every week you were here. Even when it came to, I took you off a whole bunch of supplements.
Yeah, and turmeric is so healthy. Turmeric is a great supplement, anti-inflammatory. Like, it feels like almost everybody should be on it, but after 24 hours of me being on it, I couldn't breathe. Right.
Yep. We took you off that. We took you off some other ones that you were given by your other provider. I didn't really change what you were eating because you were already on a really restrictive diet, but I changed like how you were eating. So smaller meals, chewing your food more, like being more mindful, like slowing down when you're eating. And then we mainly drove this from a neurological rehab perspective. And most people, when they have immune complications, they don't think about what their brain is doing to mediate the immune system. These things are interconnected. So this is what, I absolutely love about my job in general, is how fascinating the brain is. And that we actually primarily targeted your nervous system and reintegrated that information. And your mast cells started getting better without doing anything else, supplements or diet, low histamine, this and all those things. We were able to target this from a neurological rehab perspective and affect your immune system. Now, so you went through that treatment. You did really well in just a short 4 weeks. And again, you don't live close by. So we sent you home. And I want to kind of explain to people where you're at now in your treatment. So what have you been doing since you got home, which it's been maybe 6 weeks or so since I saw you in the office?
Yes. February 23rd, I think, was the last week in February. It was the last week I was with you.
So a couple months.
I've been home, about 6 or 7 weeks now. So the hyperbaric chamber was a game changer for me with doing the hyperbarics at your office. So finding a way to be able to do that at home was huge for me. It is not readily available in a lot of areas, and it can be quite pricey, and everybody out there knows that when you're on a struggle like this, the finances and making it work is a big part of the journey. So I was lucky to be able to find a company that rents hyperbaric chambers. I now have a hyperbaric chamber in my house for a 3-month period where I'm doing an hour to 2 hours per day. I bring my work laptop in there or a book, and I try to relax and things. So I'm continuing with that. And other than that, for the past 4 weeks, we've just been trying to like focus on just continuing, right? I've been kind of just continuing to do what I've been doing and feeling better and things like that. And now we just recently are now targeting the leaky gut and continuing to monitor the mold. So knock on wood, my mold levels have drastically decreased. We've been treating the mold even prior to coming to you guys. But so it's been since July of last year that I've been treating the mold. It's come way down, still have toxic levels of one kind that we're still working on, but now continuing with the HBOT and now trying to heal some of this gut stuff I have going on. So we recently did a stool test. We found that I have candida, which is common after a mold toxicity issue, especially since I had it undiagnosed for so many years. So I am now just starting like phase 2 almost of the protocol, right? So we went neurological first and kind of healed that. Now the immune system is kind of calming down. And now I think based on what you kind of said the other day, some of the symptoms I'm still experiencing are now like the gut stuff that we're going to continue to heal with that, and then check in on my hormones after that, because all those things have gotten all messed up too. But where I'm going with this, guys out there, is that be okay with the fact that like this is not going to happen overnight. Like it's not just like come for treatment 6 weeks and you're poof, you're better, especially somebody like me who's been doing this, trying to get answers for a very long time. Like there's phases and approaches. As Dr. B was explaining, we conquered the neurological aspect first, now the immune system, and then now we're heading towards my stomach. And then finally we'll finish with like healing my hormones and things like that. So there is a step-by-step phase process, and every single person's journey is for sure going to be different. Like there's somebody out there, maybe you have a patient now that has all the same things as me, but like you had to heal their immune system first or whatever, you know? So like, one of the things that is important on this whole journey, I would recommend to everybody is like, listen to other people around you and feel supported and validated and all the things, but try not to judge anybody else's healing journey with your journey, because it is your own journey and it's very different from everybody else's. And unfortunately, patience is important and it takes time, but that's where I'm at right now, is like just really trying to take it one day at a time and focus on my journey and what I need to do and how I'm feeling today. And that's it.
I love that. That's so inspirational. Thank you so much for those words. I know that there are people out here listening that definitely needed to hear that.
Yeah.
Last couple questions for you. So what % better at this point would you say you are overall?
So me being like the absolute worst when I came to your office for my exam, like where all of my symptoms were crazy, I would say I am about 60% better. So like on a day-to-day, leading up to it, all my days were bad. I was depressed every day. Every morning I woke up like, I can't do this anymore. I would eat breakfast, almost pass out, need to lay down for a couple hours. Like my whole day revolved around whether I could eat or not based on what I needed to do during that day. It was so much stress involved with like just surviving on a day-to-day basis, even with just daily basic functions like having to eat lunch. Like I'd have to time that around what I needed to do that day and things because of how horrible I would feel when I eat. And that is another part of my journey, is working on the mental health aspect of all of this. So traumas and the unhealthy relationship I have with food at this point, being a nutrition and exercise professional, like the unhealthy relationship revolved around like, if I eat that, it's going to make me feel horrible kind of thing. So also tapping into that. But I would say I'm about 60% better on a daily basis, where like I'm not worried about eating something because I won't be able to work after or go to the store after or something. Like I'm not so hyper focused on like surviving the day. Most days are feeling pretty decent, which is great. And then I'll randomly have like a day where maybe I overdo it. I didn't listen to my own advice, and maybe I worked too much or did too hard of a workout. You'd be surprised. Like, I mean, I used to train 8 boot camps in a single day, 6 days a week. And now sometimes me just working on my computer for too long can send me into like a symptomatic day the next day. So, but those days are much smaller than they used to be. There's usually maybe one bad day per week, every other week, I'd say at this point. And my bad days are still dramatically better than what every day used to look like. So just taking it one day at a time in terms of the symptoms. And I will be honest, I get frustrated sometimes, but like you get impatient, you get sick of like having to listen to your body, and you want to just be normal again kind of thing. But those are the days that I just go to bed early and start fresh tomorrow. And it usually ends up being a much better day the next day. So
I love that. I feel like that's a lesson, not just for patients, but for everybody, is like tomorrow is a new day sometimes. Yep. Sometimes you just got to go to sleep and get a good night rest. And that can be really helpful.
I went to bed at 8 o'clock yesterday.
I love that. I was shortly behind you too. Wonderful. I think it would be really awesome if you'd be open to coming back on, probably in a couple months after we go through this next phase that we're working on in terms of supporting your gut, making sure those detoxification pathways are. A lot of times when we're talking about gut health and liver function, that itself can be aspects that really throw off what's going on with your hormones. So we know that you're experiencing some of those symptoms. We know there's other things you want to do, with your life in terms of having babies and getting all excited about those things. So we're talking about what that looks like as you start to get better. And I think it'll be really interesting to have another conversation about what that looks like once we get to that place and how things are looking once we've really supported and helped to heal your gut.
Yeah, for sure. I mean, I've said it a million times already on this podcast today, but like you need to give yourself grace and take it one day at a time and rest and all the things. But it is super important, I think, as well, to be positive and look forward to the future and still have goals and things like that. So I hope in a couple months from now, you can have me on and I will be back to my athletic self, like doing my HIIT crazy burpee workouts and things that I used to love and do, and maybe talking to my husband about when we're going to start trying for babies and things like that, and get my life going again, because it's felt like my life has been on pause and survival mode for a very long time. So I'm excited to keep dreaming about the future, and you have me back on, and I'm going to tell you guys all how great I'm doing with it.
I love that. I love that so much. And just a reminder to everyone, healing is not linear. And I think Kristie did a great job of painting that picture. But you do got to remember, every day is a new day. Things will be up and down. But a lot of what we talk about with our patients is how things are going from month to month, not so much from day to day, because it really is hard to see the forest through the trees. Mm-hmm. So, Kristie, thank you so much for all the inspiration. And we really appreciate you being on.
Yeah, you got it. Can't wait for to come back on and tell you how great I'm doing.
Thanks so much. Talk to you soon.
Guys.